We need to know how much we need every day. We need to know where to get it. We need to know how much the body uses every day, by what pathway and for what purposes, and how do you tell whether you're getting enough. That's been my focus as I've approached this vitamin D problem. Most of the work in the vitamin D field, and some of it's just tremendously astounding work, has been focused more on mechanisms. That is, what does it do, how does it do it, etc., and has completely ignored the how much question. I found there was not a single paper in the medical literature up to the time I got to work on it that had measured how much vitamin D you needed for how much absorption.
Vitamin D is a profoundly important nutrient that provides us with so many health benefits. Do we need to supplement? If we do, what are the proper levels? Hi, I'm Dr. Mercola, helping you take control of your health, and today we are joined by Dr. Robert Heaney, who is a professor and researcher who has worked for over 50 years in the study of osteoporosis, vitamin D, and calcium physiology. He is clearly one of the most well-respected researchers in this field, and it is just a major privilege to be able to dialogue with him today about this really important topic. So thank you so much for joining us today, Dr. Heaney.
My pleasure.
So we've talked before, but it's been a while, and we're just wondering if you could briefly review some of your background to give our viewers an understanding of your perspective and how you got into this area and what you're doing now.
Well, I'm a physician trained as an endocrinologist and have been working here in Creighton's Osteoporosis Research Center since the late 1960s. Our focus has been bone biology, what makes the bone strong, what the various treatments do, etc. Well, inevitably, when you deal with bone, sooner or later your paths cross with vitamin D, which is vitally important for a whole host of functions, the most obvious of which is the promotion of calcium absorption. Of course, you need the calcium for bone health, but that's kind of how I got from where I started to where I am right now. And in the last several years, probably 20 plus now, I've been focusing almost exclusively on vitamin D. Probably the best way to describe my focus is in terms of your bank account. It's important to know you have one. It's important to have some money in it, but it's also important to know how much is in it, how much you're depositing every month, how much you're withdrawing, how the balance is changing over time. Do you ever get below certain minimum levels, etc.? Well, the same thing's true for the vitamin D economy. We need to know how much we need every day. We need to know where to get it. We need to know how much the body uses every day, by what pathway and for what purposes, and how do you tell whether you're getting enough. That's been my focus as I've approached this vitamin D problem. And as you probably know quite well, most of the work in the vitamin D field, and some of it's just tremendously astounding work, has been focused more on mechanisms. That is, what does it do, how does it do it, etc., and has completely ignored the how much question. For instance, when I first got involved with the measurement of calcium absorption, I assumed that it had all been worked out. I found there was not a single paper in the medical literature up to the time I got to work on it that had measured how much vitamin D you needed for how much absorption. Just strange. We seem to have been satisfied with the mechanisms, but not with the how much question. So I've been focusing on how much.
Well, terrific. This certainly is a key central question. And then, of course, the devil's in the details. So there's a whole variety of variables that factor into the answering that equation or that question. So why – actually, maybe if we have a little bit of a perspective, because you're a long-standing researcher. You were in this field well before vitamin D became popular. But it seems that one of the events that catalyzed the interest in vitamin D was the creation of an relatively inexpensive lab test to actually measure it, which is going to lead into your question. So maybe you can discuss the time around there. I think that was the last century, late last century that occurred, because prior to that, you really couldn't measure vitamin D easily. So maybe you can share with us your perspective of that event.
Oh, you're absolutely right. Science advances when you can make measurements. And when you can't make measurements, then we accumulate information very, very slowly. Now, there were research methods for measuring vitamin D that go back into the 1970s, but they weren't clinically available. And it wasn't until somewhere in the 1990s that it began to be accessible to the average physician. In the 1997 edition of the Dietary Reference Intakes from the Institute of Medicine, we summarized what was known at that time, and I was on the panel that did that, what was known about vitamin D. And about the only thing we could be very certain about was that the right way to tell what the vitamin D status was to measure serum 25-hydroxyvitamin D concentration. So that's that measurement you were referring to coming into this last century, or the end of the last century. And that has stimulated a tremendous growth in interest in and research involving vitamin D. Physicians started to order it in what they thought were completely healthy patients, and lo and behold, they got values back that were low or even undetectable in some cases. And so that surprised everybody, and that stimulated a great deal of interest in supplementation with vitamin D.
Terrific. So prior to that, vitamin D didn't get much notoriety because it was thought its primary and probably only use at that time was to the prevention and treatment of rickets, which of course is important for. But since that time, we've learned quite a bit more. So I'm wondering if you can summarize some of the highlights of the benefits of vitamin D.
Vitamin D, like many of the micronutrients, is involved in the biochemical cellular machinery of all the tissues, all the cells in our body. And as with any of those micronutrients, if you don't have enough, then the machinery doesn't work as well as it ought to. And that means your total body has problems. Now, we recognize some of them, such as you mentioned, rickets in children and osteomalacia, but they're only the tip of the iceberg, basically. And in order to get a good feel for this, I think it's useful to call to mind our dependence on cell biology. When I was in medical school, we knew that the nucleus of all the cells of our body contained DNA, and that DNA was enough for the plans to make a whole new human being, a whole new organism. And we never really quite knew why that was so, because a skin cell was never going to be anything other than a skin cell, and a muscle cell was going to be a muscle cell. So why did it need all of the DNA for a whole human being? Part of it made sense. I mean, for instance, if you cut yourself, you had to heal the cut, so you had to make new skin cells, and at least you have to have the plans for skin cells. So that much made sense. But what we didn't know, and it's now been maybe only 10 or 15 years that we've gotten a good feel for this. What we really didn't know was that every minute of every day, the cellular machinery in our respective tissues is constantly renewing itself. And in order to do that, it has to go into its nucleus, find the plans for the proteins it needs to synthesize, and then transcribe those plans so that you now make the biochemical machinery that may be necessary. For example, if you're a macrophage and you encounter a tuberculosis bug, the important thing is to synthesize some of the defensins that are built into your DNA to allow you to attack that bug. Well, in order to do that, you've got to get the plans out of the nucleus, and then you have to synthesize the needed cellular equipment. Or if you're a mammary ductal cell, you've got to respond to estrogen. That's a perfectly normal signal, but it won't happen unless you have the right biochemical machinery. So the presence of estrogen stimulates the nucleus to release the information needed to make the proteins that will allow the cell to respond. That's all background. What we didn't know until very recently is that a part of the apparatus that opens up the genome is the active form of vitamin D. And in the absence of that active form of vitamin D in that cellular environment, the cell cannot access the information in its own plans, its own DNA library, as it were. So under those circumstances, nothing works right. And the lower your vitamin D status gets, the worse the problem. That's why there are reports related, for instance, to immune competence, to calcium absorption efficiency, to bone strength, to balance, to all kinds of outcomes, because every tissue in our body effectively needs that vitamin D. And in the absence of adequate vitamin D, it just doesn't function very well. It's kind of like sending a fighter into the ring with one hand tied behind its back. You're not going to do a very good job of dealing with the adversary under the circumstances. So that's the role that vitamin D plays.
Okay, well, thank you for that review. And wonder, let's get to the central role or question, which is, how much vitamin D do we need? And before we can answer that question, of course, we have to know what the optimum levels of vitamin D are. And that is somewhat of a controversial question. And I'm wondering if you could review the answer to that from your perspective and what the science shows.
Well, the embarrassing secret about the whole field of nutrition is that we don't have any a priori idea about what normal is. Absolutely no idea at all. If you look at the book on the dietary reference intakes issued by the Institute of Medicine, the general reference book, not for specific nutrients, but just simply about requirements per se, you'll find a diagram in there which relates the effects of nutrients in terms of risk. Too little increases the risk of deficiency, and too much increases the risk of toxicity. There's nowhere any reference to benefit. I mean, it's all minimization of risk. And so the Institute of Medicine, in approaching most nutrients, and certainly this is true for calcium and vitamin D, for example, the Institute of Medicine, in approaching those nutrients, defines the requirement as the least you can get by on without developing a certain disease. It's not in terms of how much is optimal, how much produces the maximum amount of health that you ought to have. It's how much do you need not to get rickets or osteomalacia, for example. Now, if you take that approach, then you end up with a requirement that's pretty low. On the other hand, if you take an approach that's based in physiology, you end up with completely different numbers. For example, if you want to know how much vitamin D you ought to have in order to minimize the body's need to compensate for the amount you're getting, compensate, that is, adapt or make up for what you're not giving, then the way to measure that is to make certain that the parathyroid hormone levels are at a functional minimum, and you're not constantly having to ramp up your bone resorption in order to get the calcium you need, because you're not absorbing it because you don't have enough vitamin D. When you do that, you end up with a vitamin D requirement that is in the range of 40 to 60 nanograms per milliliter of 25-hydroxyvitamin D. And the question is, how much vitamin D do you have to get in through your skin or mouth in order to maintain that kind of a blood level? I'll come back to that in a minute. But let's go back to another approach. You can ask yourself, for instance, how much vitamin D does a nursing mother have to take in every day in order to ensure that her milk will contain the vitamin D her nursing infant needs? Very recent work coming out of the Medical University of South Carolina has shown definitively that that woman needs 6,000 international units of vitamin D per day, every day, in order for her infant to have an adequate nutritional status as far as vitamin D is concerned.
Is that Dr. Bruce Hollis's work?
Bruce Hollis and Carol Wagner.
Okay.
They've done absolutely path-breaking work in that regard. Now, it turns out that the blood level the mother has in order to support that is just about in the same range that I mentioned a moment ago, the range that minimizes the need for parathyroid hormone adaptation, and that's 40 to 60 nanograms per milliliter. Now, a third approach would be to say, well, what would we have had when we were evolving as human beings on the equatorial plains of East Africa? We don't have a time machine, so we can't go back there and get a blood sample from some of those folks, but we do have various tribal groups living in East Africa right now following something close to ancestral lifestyles. And they have had their blood 25-hydroxy-D measured by Dutch investigators. You won't be surprised. The number they find is between 40 and 60 nanograms per milliliter of 25-hydroxy vitamin D. And that takes, just as it does with the nursing mother, about 5,000 to 6,000 international units of vitamin D per day coming in from all sources. And so it's not just my viewpoint. I take the viewpoint that nutrients produce benefits, and what I want to know is what is the status that would have obtained when human physiology was evolving, because natural selection tunes us to what the environment provides. If the environment didn't provide enough vitamin D to maintain that kind of a level, then we would have found some other way to adapt to it during the course of evolution. But we didn't, and so it's very useful to look at what those ancestral living humans today actually have, exposing a lot of skin and living in equatorial East Africa where the sun shines all the time, and where you can make vitamin D every day. That's the best evidence I know of about what is optimal for our physiology. And I find it very compelling that those three distinct approaches, one, what's the minimum compensation required? What's the ancestral value? And how much do you need for a critical function such as lactation? They all converge on the same numbers, somewhere in the range of 40 to 60 nanograms per milliliter of 25-hydroxy-D, and a corresponding oral dose of somewhere in the range of 5,000 to 6,000 from all sources combined, not supplements per se. We do need supplements, but that's the total input every day needed to sustain a blood level of 40 to 60.
Well, thank you for explaining that so well. But the big leap, though, appears to be that it's fairly easy to establish the reference ranges or of which appears to be optimal, which you said is 40 to 60 nanograms. But the big challenge that we have is to convert the oral equivalent to reach those levels, I guess, because our ancestors didn't really have access to oral vitamin D supplements. That's a relatively recent innovation, and it was really almost exclusively through exposure to sunshine.
Well, that's true, or I should say almost completely true. It turns out, and again, we didn't know this until we really dug into the vitamin D story more deeply, all members of the dog and cat family, wolves, tigers, lions, wild cats, whatever, none of them can make vitamin D in the skin. They are totally dependent on meat. That's where they get their vitamin D, from the prey animals that they live on. And we had simply ignored the fact that we were getting vitamin D in meat as well. That is, if we eat meat. And the reason we ignored it was too hard to measure. Most of the assays that had been published up until very recently listed no vitamin D content for beef or pork or poultry, etc. Things are changing in lots of ways. One, we have much better ways of measuring vitamin D than we did back then, and so we're now finding vitamin D present in quantities that are biologically meaningful. And secondly, manufacturers that is, food producers, are now making certain that the food chain they feed their animals contains adequate vitamin D, and sometimes they use a little bit more than perhaps is minimally necessary. And so that gets some vitamin D into our food chain, and we don't know exactly how much. But my best guess today, and I'm going to qualify that by saying guess, because this is a moving target, and we don't have all the data we need yet. My best guess is that the average adult today living in the central part of the U.S. is getting 1,500 to 2,000 international units from food, unrecognized sources, food.
Interesting.
And they get less than we used to think from sun, not because they couldn't get it all, but look, it's 1:30 in the afternoon, 2 o'clock my time, and I'm indoors in front of a computer getting no sunshine. So I'm not making any vitamin D. And most of us, health professionals, wage slaves, workers of one kind or another, we're indoors. Not very many of us work outdoors. Not very many of us get sun exposure at midday, and that's when you can make your vitamin D.
Well, even if you could, which, as I mentioned, is the exception, you're in Nebraska, and as we're recording this, it's within a week or two of the winter solstice. So even if you were outside with just your briefs on all day, I don't think you'd be generating much vitamin D.
I'd be making zero. My colleague in Boston showed that. Boston and Omaha have just about the same latitude, and Mike was out there on the roof in his briefs, as you say, and he made no vitamin D.
Yeah, so this is really interesting information about the quantity of vitamin D in food or meat specifically, and I was not aware of that, and that certainly seems to provide a fairly compelling argument for the use of oral supplements.
Yes, it's entirely natural, and I think the important thing to understand is that it's not that we're a lot better off than we thought we were because we're getting this unrecognized vitamin D. It's that we need a lot more than we thought we needed. And so we've still got the same gap between the total amount we're getting in every day and the amount needed in order to sustain a level of 40 to 60 nanograms.
Now, do you think there's any additional benefit from getting the majority of your vitamin D from solar radiation as opposed to swallowing it orally? Because, I mean, there's a vitamin D component, but then there's these perhaps other variables that we may not yet appreciate fully.
Oh, I think you're absolutely right. There is a UVA component which does not produce vitamin D, but does produce nitric oxide, and that has a blood pressure lowering effect. The full solar spectrum is important for us. We're not dependent just solely on a narrow band of wavelengths, about 295 nanometers, which is where vitamin D is made. Total sunlight is beneficial, and some of that benefit is due to vitamin D. Some of it is due to other mechanisms I'm sure we don't fully understand.
Terrific. So I'm wondering if you could address the issue of toxicity, because that's a concern. And early on, like last century, there was really quite a serious concern for taking doses of more than 1,000 or 2,000 units. And so there's the question of the dosage, but then there's also the question of the level. So you mentioned the ideal range somewhere between 40 and 60 nanograms. So is there a danger for going to 70 to 80 or even 100?
Well, the important thing is to be clear about what we mean as toxicity. The Institute of Medicine and various other experts have defined toxicity as hypervitaminosis D, or vitamin D toxicity, which consists of excess serum calcium and kidney stones and calcification of the kidney and all the other problems that can go along with excess serum calcium under the circumstances. If you focus on that, then the good news is we have a very wide margin of safety. There are no reported cases of any elevation of serum calcium below 30,000 international units per day. And for the most part, there are none below 50,000 international units, but there's a gray zone between 30 and 50. But there's no reason to go above 30, so, I mean, there's a good margin of safety. Furthermore, if you look at the blood levels of 25-hydroxyvitamin D, there are no recorded cases of vitamin D intoxication at levels below 200 nanograms per milliliter. We're talking 40 to 60 here is the optimal range. So there's no real concern about toxicity until you get up into doses you shouldn't be taking. And those are almost always associated with either sloppy manufacturing practices or deliberate poisoning of people. And both kinds of cases have been reported. And you mentioned last century. Back in the 30s and 40s, we were using vitamin D in doses of millions of international units per person per day, and we did produce some toxicity that way. No doubt at all about that. In some cases, fatal. Fortunately, most of the recorded cases recovered, I presume reasonably well, but there is a problem. It's a fat-soluble vitamin, and fat-soluble vitamins, when taken in large quantities, are stored in the body, and they can exert their toxicity for a long period of time. So it's a powerful compound, but it's a relatively safe compound if we stick within reasonable intake levels.
Okay. Well, this is great. I really thank you for everything the summaries that you provide and the perspective, especially on the vitamin D content of meat, which seems to be a highly powerful piece of information to support and substantiate the use of oral vitamin D. Which I've always recommended that people get it from the sunlight if they can in any way, shape, or form, or a relatively safe tanning exposure, sensibly exposed, but it does provide a good perspective from oral supplementation.
Yeah, I don't think it's a matter of either or. I think it's a matter of both and I think the sun is beneficial on balance.
Terrific. Do you have any other closing comments you'd like to make, or?
No, I think this is an extremely important nutrient. I think that the bulk of the population of the industrialized nations is vitamin D deficient, and that's contributing to the host of chronic diseases that are filling the doctor's offices and using up our healthcare dollars. And we need to do something about that. The problem with vitamin D is that it's cheap and not patentable. And so it's very hard to get the kind of saturation promotion that you would get with a new antihypertensive drug, for example, where nobody can pay to have advertisements in the journals. It just costs too much. Vitamin D is very inexpensive, but very powerful. And we need to keep in mind that under more primitive circumstances, we were getting a lot more from the sun than we do today. I think if any of you can think back to your own grandparents, you'd realize they spent a lot more time outdoors. They hung the washout on the line to dry. They walked to the bus stop or streetcar stop and they got fresh air, and they worked out in the gardens. There was just a lot more outdoor time and sun exposure. People are scared to death now of skin cancer, but nobody was dying of melanoma back in those days. It just is. I fear we have a problem that's been created by the cosmetic industry here, rather than a real problem for cancer prevention.
All right. Well, I can't thank you enough for all the pioneering research you have done and continue to do, and all the efforts you've really made in helping educate us about this important topic.
Thank you for the opportunity.